Going to be going through the manual muscle test for the external abdominal oblique in this video here. So we've already gone through our palpation in a previous video. And we're really going to kind of focus on what this external oblique does, which is a contralateral rotation of the trunk, as well as lateral flexion and flexion of the trunk and spinal joints. So that is more the upper rib and spinal area. However, because it's attachment to the pelvis, it is also going to be doing a posterior pelvic tilt, but we aren't going to be focusing on that for our resistance and the active breaker concentric part of this test. So I'm just going to briefly show you again what I'm going to have you do. So from a lying down position, you're going to go into flexion, lateral flexion, and a contralateral rotation, which basically means you're going to be trying to bring this shoulder over towards your opposite hip. So one of the ways that we help people with this action is you almost have them slide their hand down the table and then have them flex and contralaterally rotate to across the body like so. Okay, so just as a reminder, contralateral rotation is a little bit tricky here, but I'm activating the right external oblique and he's rotating towards the left, which is why that's known as contralateral rotation. If he was moving his left shoulder towards his right hip, that would be rotating towards the muscle, and that is the internal fibers. So because of external fibers, we're going to be bringing the shoulder to opposite hip. Okay, let's have you do that one more time unassisted this time and rotate towards me. Excellent, and you can go back down. So that is our active range of motion. Again, we're looking for that shoulder to come right up off the table. We're looking for the chest to lift up a little bit, and then obviously the rotation towards the opposite side of the body. He's going to go partway through that motion. So again, over and then up for me. And this time I'm going to push down on his shoulder while holding his pelvis. 3, 2, 1, and relax. So again, we're getting a little bit of shaking through that motion, which is fairly common. However, he was able to hold up against that pressure. And so finally, exact same hand placements. I'm going to have him do that same motion. I'm not really resisting the lateral flexion so much, but definitely focusing on that flexion and contralateral rotation. And you can go back down. Okay, so active, break, and concentric. And in just a second or two, we're going to be turning him over into the prone position. All right, now that we've turned our person over into the prone position, we're going to be lengthening that right external abdominal oblique that we were palpating. So for this purpose, I'm going to be needing to extend him, laterally flex him away, but then rotate him towards the side. So this motion's a little bit tricky, so I'm going to do this a couple times just to make sure that everybody's on the same page as me. But basically, I'm going to ask my body permission to put my hand underneath the shoulder. Yep. And we're just going to bring this arm out to the side a little bit. I'm going to reach underneath up through the axilla and cup the front of this glenohumeral joint. So this is going to be one part of this. The second, my other hand is going to go on the top of the opposite shoulder. So I need to laterally flex him away from the side that I tested, which means I'm going to pull him laterally away. Now I'm going to be picking up the shoulder and extending his torso and rotating him towards the side the muscle was on. Okay, so this is our length position for the right external abdominal oblique. All right, I'm going to reset again. So just for clarity, to make sure, the external oblique does flexion, lateral flexion, and contralateral rotation. So for my length, I'm going to again do this one more time. I'm going to reach underneath. I'm going to laterally flex away. I'm going to extend and rotate towards by using my body weight and picking up on that shoulder and twisting him towards the side of the muscle. So that is the length position for the right external abdominal oblique.